Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio, and you get Dr. Darrow's book for free, Stem Cell and Platelet Therapy. That number again is 866-870-5752, and we are talking to Chris in Sylmar.
Hey, Chris, it's Dr. Marc Darrow. I just want to give a little quick blurb before we finish up with you, and then we're going to get to Linda. And I got to get to Linda because the call screener said she's one of my patients, and I am wonderful. So, of course, I want to talk to her. So, Chris, I'm just going to give a real quick thing of what I do here. It's called regenerative medicine, and I use stem cells and platelets to inject, to regrow the musculoskeletal system, all the orthopedic injuries, everywhere from the head, neck, back, shoulders, elbows, wrist, fingers, knees, toes, you name it, arthritis, meniscal tears in the knees, rotator cuff tears like you have, Chris. And, the basic answer to your question, Chris, is before you let someone put a knife in your shoulder, I don't care what your MRI says, please come in, let me take a peek at it, and it won't take you long, and we'll see if we can heal you without a surgery, because that's really the name of the game. Anybody that calls into the show gets a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I mail it out to them, and it's got a couple hundred pages and 250 studies on how regenerative medicine works and why surgery really is not a very good option anymore. That's for the old days when we didn't have this. So, Chris, God bless you. Thank you so much for calling in. The number to the office, if you want to call, is 800-300-9300. Now I'm excited to get to Linda. Linda, give me your laugh. Let me hear you. There we go.
Good morning. How are you?
I'm great. So Linda is one of my favorite patients. She's an actress, very beautiful redhead. And
well, thank you so much.
And
Dr. Darrow is wonderful.
Oh, no wonder I love you.
Well, I came to see you as my chiropractor recommended you, Dr. Monaco.
Okay.
And I've had bone on bone for decades, and I went to see an orthopedic surgeon. Oh, yeah, we can do that. Slice up your knee. And then you have to come back in 15 years and have a new thing put in. I thought, well, what the heck? So I thought, oh, never mind. So I have never been sliced and diced. So I'm so thankful I went to see Dr. Darrow because he's jabbed me with his stem cells. And now I've got a wonderful knee, and all the arthritis on the side is gone. Oh, I'm so thrilled with that. So
you're making an amazing point, Linda, and that is, I hear the term bone on bone every single day, all day long, and I rarely have ever even seen bone on bone. It's just, it's a name that doctors use to induce you to have a surgery. And I'm not saying they're bad guys. I love orthopedic surgeons. They do the hardest work in medicine. I respect them. I just don't respect the surgeries they do that don't need to be done. And yours would have been a surgery and then another one, which would have been a knee replacement that you never needed. And
that's what he wanted to do for sure, a knee replacement.
The other thing I wanted to mention about you and give people an option of this is you and I text each other every single day.
Yes, we do.
And do you want to tell the folks why we do that, other than we like each other?
Because I got too beefy. And he was kind enough to say, well, if you want to text me every day on your progress of your weight loss, I said, okay. So I've lost 20 pounds because
yes,
I text him every day and I don't want to look bad. So, and that's just the beginning, because I got way too beefy, and I used to be 120 pounds when I was 30, and I'm way past that now. But I'm getting.
I was 120 pounds when
yeah.
I was 12. So one of the things that Linda does, is it okay if we give out your last name too?
Sure.
Why don't you say it?
Linda, Montana, like the state.
And the thing I like about your name is you're kind of a cowgirl. I've seen videos of you.
I am.
What's it called when you use the rope and spin it and make
I'm
big
a trick roper.
Yeah, trick roper. And do you do that?
I do a big loop. I know 65, 75 feet long. I used to do it sitting on my horse and roping all the way around my horse. And then I do cotton routine and do 2 loops. When I was younger, I used to do a Texas skip, but not now.
You're still younger. You know why you're younger? I tell this to people all day long because they say I'm getting old. I go, in 20 years, you're going to look back at today and go, I was so young. It's all relative.
Well, goody. If I have 20 more years, that'd be great.
Oh, you got more than that. So I've always had a question I never asked you. I know you're an amazing roper, whatever that's called, a trick roper. But do you do that as an actress, or is that just something you do for fun?
Oh, no. I used to work in rodeos and fairs with my family. My father was Monty Montana, a very famous cowboy trick roper.
Oh,
And I
yeah.
did that at least when I was 10 to, 26, thereabouts. We worked Pendleton Roundup, Cheyenne Frontier Days, Denver Stock Show, Calgary Stampede, the top shows all around the country. In fact,
what kind of acting work are you looking for now?
Acting work?
Well, you're an actress.
Oh, yeah. Well, I've been doing self-tape auditions in my front room using my phone and then editing and sending it on.
Okay.
And I've been up for some really nice parts. We'll see what happens. But I trick rope for a commercial. So my agent said that I got
wonderful.
it. So I hope and pray. So I won't say
too.
what it is yet until it's in the can.
No, I don't blame you.
After I do it.
I don't blame you, exactly. Always keep the energy to yourself. So I'm glad your knee's better, and from what I remember, you have arthritis and a meniscal tear. Is that right?
Arthritis for sure. I don't know about any meniscus or not.
I
That's
think
your
so.
territory. I just know it hurt for a long time, for a lot of years.
And
so
you're able to get around okay and you're okay without pain now?
Yeah, if I step a little funny, then I go, don't step that way.
You're
be
so
careful.
funny.
So,
Anyway, Linda, I can't wait
everything...
I'm going to say it like this. I can't wait to see you again, but I hope it's not for body pain.
Well, I look forward to seeing you too, because you are wonderful. Anybody who has a problem, come see Dr. Darrow. I sent my girlfriend, and she had her shoulder shot up, and she said, ouch, which I said, yeah, but the results are so much better. It's worth the ouch.
Oh, God bless you. I really appreciate you calling in. Yeah, that's amazing. Thank you so much for calling. And your story is a story that's very common.
Everybody, go see him because he'll fix you right up.
Oh, I love you. Thank you so much. I appreciate the kudos. All right, Linda.
Thank you,
see
Linda.
You when we see you.
Appreciate your call.
You're quite welcome, and happy Thanksgiving.
You too.
I hear from Linda every single morning. When she wakes up, she texts me her weight. And if it's not going in the right direction, we have a conversation, figure out what it is. Because most people don't realize what it is that's causing their weight gain. They don't know what carbohydrates are. And I prefer people use a ketogenic diet, which cuts out the carbs. And men lose about 5 pounds a week. Women lose about 3 pounds a week. It's real simple. Just look up keto diet on Google. It'll give you all the information you need. So, Anita, I'm going to give out the phone number to the studio in my office. Yes. So everybody get your pencils and paper to talk to us live right now, to Nita and I. You can call 866-870-5752. If you want to reach me at the office, it's 800-300-9300. And the website, if you want to watch videos of the procedures of stem cells and platelets, you can go to www.lastemcells.com, and you can email me from any page there. Nita, have you noticed that everybody seems to have a little in their voice lately? It must be the wind.
Yes. Well, for me, it's
dry.
the wind. I have terrible allergies, so it's definitely the wind.
You know what you do for allergies? You go to my buddy Alan Green. He's across the street from me in West LA, and he does a procedure called LDA. That's low dose antigen. It's little injections on the forearm. It gets rid of most allergies almost overnight. No promises, but I've had good results with it. I was bragging to a couple of patients 2 weeks ago how I haven't been sick in 3 years since I had LDA. Guess what happened that night?
You got sick.
I got that cold that was going around.
Yeah,
I checked myself for COVID 5 times. It wasn't that. It was just a cold.
Wow.
And next week I'm going to go see Dr. Alan Green and get another LDA round of injections to help clear up the allergies.
What kind of doctor is he?
Dr. Green is, I'm guessing he's family practice, but he does a lot of alternative medicine type things and heals a lot of things that traditional doctors don't know how to do. He's a great guy.
Well, that's great information.
So, Nita, what do you think? Is torture Nita time?
No, I think it's time to talk about the book again, because this is if you're shy, you still want to call the show today because you want to get the free book, and we need your name and phone number to call you and get your address later and send it out. It's very simple. It's like no big deal. And you just call 866-870-5752, and the book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Now, what do you think that title means, Regenerate, Don't Operate? That means the whole point of the show for the last 20, 25 years is that you can do regenerative medicine and in many cases avoid going into elective surgeries, which are extremely invasive.
Well, I'm gonna say it like this. I'm gonna be kind of bold. If it's elective surgery, you don't have to do it. You're electing to do it. It doesn't have to be done. It's not an emergency. And most of those cases we can heal using stem cells and platelets. Not everything. It's not a panacea for everything. We have to choose our patients correctly. And we're going to go to, is it Sherry or Cherie?
Cherie.
Cherie. Hi, Cherie. Dr. Marc Darrow, your neck is bothering you. How long has that bothered you for?
Yeah. Since 17, I had, and I've had physical therapy because I had a fall, and I've had physical therapy, and I also have some back pain at sometimes because of the fall, and I had I just want you to know I had stem cell on my jaw.
Okay.
And it worked wonders.
Did you have
at
TMJ?
Mayo Clinic.
I
did. And
Okay.
I had, and my jaw was degenerating, and I had arthroscopic, where they just go in with 2 needles, you know?
Yes.
I had it at Mayo Clinic.
Right.
And I had the stem cell over a year ago, and I've had pain-free, nothing.
Oh, wonderful. Let me ask you a question. Did the surgery you had get you better?
Did the surgery get me better?
Yeah.
I think cleaning it out, and I think because I didn't have any cut, just they went in and cleaned it and then did the injection. I think the stem cell, that's what I think did it, that rejuvenated.
Okay. Well, I do TMJ all the time. I think it's, in my opinion, in my humble opinion, it's a miraculous treatment.
Yes.
TMJs heal very, very well. I've had a lot of people that have a lot of grinding. I don't tell them to get a surgery first, Cherie. We just do the stem cells or the platelets in the TMJ, and they seem to get better. I'm not saying you shouldn't have had the surgery, But because if it worked, and that's amazing. But I've never sent anybody to surgery for temporomandibular joint dysfunction.
Mine degenerated, and so I needed it cleaned out. And they go in with 2 needles on the side.
I get it. But you're saying you needed it because they told you needed it, and what I'm telling you is you may not.
I'm not doubting Mayo Clinic. I'm just calling because my neck hurts.
Okay.
And I'm wondering about that because sometimes it's hard to turn a certain way,
Okay.
And that's what I'm concerned about.
Okay. Well, I'd need to examine your neck first. I can't tell you over the radio if I can help you or not. But by touching your neck in literally about 10 seconds, I can tell you if we can help you or not. And that's not a promise. If I say, I think we can, I never promise anyone anything.
Sure. I understand.
Now, I want to say one thing. I'm not putting down Mayo Clinic. I'm just saying there's a lot of cases where surgeries are not needed at all that people get.
Yeah. Oh, I can understand that.
I mean, Mayo Clinic is not the god of medicine to me. It's just another clinic. And they do good things, and they do things.
As far as I'm concerned, they pain-free, and I have been.
Listen, as far as I'm concerned, I'm grateful you had done what you had done because you're happy.
Yes, and
I don't care if it was Mayo Clinic or Schmayo Clinic. I'm just glad you're happy.
Right. Okay.
All right, so if you want to get to the office now, the phone number, there's people there, is 800-300-9300. Thank you for calling, Cherie. God bless you. We're going to go to Steve. So, Steve, this is Dr. Marc Darrow. Tell us what's going on.
Yeah, good morning, doctor. I just called because, and I was encouraged to call because of your one of your last callers, Miss Montana. And when I was in elementary school, Monty Montana came and he rode around the play yard and did these wonderful tricks. And he chased down our 5th grade teacher and roped him and dragged him in. It was just
that's so funny.
But in addition to that, I also wanted to thank you because you've helped 2 people that I've sent to you, one with the shoulder and one with back. And so I thought I would add those compliments to you.
Well, thank you so much. I appreciate referrals. Obviously, it keeps the business going and helps us heal lots and lots of people.
Well, and so also have a wonderful Thanksgiving.
Well, God bless you, Steve. I appreciate your call.
Thank you, Steve.
Bye.
So the number to the studio to call Nita and I right now, get information about stem cells and platelet therapy, and if you can, regenerate the body, don't operate on it. And that's the byline to my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. You can use your platelets and or stem cells and often heal things that a lot of people would get surgery for. If you call, there's that little tickle. If you call the studio right now at 866-870-5752, 866-870-5752, I will mail you out a free copy of this book, which has over 250 studies on how regenerative medicine with platelets and stem cells works, and how surgery, there's a lot of studies that show surgery is not a good thing. I'm not saying it's a bad thing. It just depends. If it's an emergency, it may be a great thing. But most surgeries that are done in orthopedics are elective. The greatest percentage of surgeries in orthopedics are elective. Please get this. Elective means you get to decide, not the surgeon. You're electing. That means you can do it or not do it.
Sounds good. And the book, again, is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and you get it for free when you call the program.
And the beautiful Suzanne Summers wrote the foreword because I've worked on her and her family.
And she put you in her latest book,
That's
which
true.
is
I forgot
called
about that.
A New Way to Age. And you
But guess what, Nita? I'm going to go to Matthew.
Okay.
Matthew, you got a shoulder also.
Yes, hello, doctor. I have a lot of shoulder pain when I lift my arm.
Okay.
So it's very uncomfortable.
Okay. And can you lift your arm all the way up?
I can, but it hurts.
Okay. So you have good range of motion. Have you had any doctor visits to find out what they think?
No, I have not.
How long has this bothered you for, Matthew?
Probably about a year.
Okay. And what caused it? Do you remember? Or it just came on by itself?
Josh, I don't know.
Are you an athlete?
I have no
Do you
idea.
do any repetitive work over your shoulder?
No, I'm pretty much retired.
Okay. How old are you?
I'm 67 years
You're a
young.
baby. You're a baby. I'm 74. You're like my little brother. So I don't know if you know my story about my shoulder pain that I created weightlifting. And I healed it up using stem cells and platelets. So I can't tell you if it's going to work for you until I examine you. I don't really care if you go to another doctor and they tell you something or they get an MRI. I've got to touch it myself, move you around, and see what's going on.
I get it.
So,
Doctor, did you know that a dog cannot operate an MRI machine, but cats can?
I love it. That's
Oh,
good.
that's a good one.
You're supposed to tease Nita and make her answer it.
Well,
Thank you for not doing that,
So-
Matthew. But it's a great joke.
so
You know what? I'm going to hit up Nita with that next week and see if she remembers.
Okay.
So do I have to make an appointment, or do I just come in, or what do I do?
You could do whatever you want. It's better to have an appointment.
Yeah,
I mean,
understand.
you can call up the office now at 800-300-9300. We'll talk to you.
That sounds good.
I mean, if you walk in, there's a chance I'll be able to come out from patients and say hi, but I can't promise that. It depends how busy
All
how many
right.
procedures
Well, I'll
I've
make an
lined up.
appointment then.
It's safer, yeah. Some people do just walk in, though. And often I can get to them. They'll call me out, and I'll just do a real quick exam. But then they still have to come in and do an intake and all that stuff before I can treat them. So it's better to just make an appointment.
All right. Well, I will make the appointment.
All right, Matthew, God bless you.
Thank you,
I
Doctor.
think there's good hope.
You.
I think there's good hope for your shoulder. It doesn't sound terrible from what you're telling me. And I think there's a good chance the platelets and stem cells can heal you up, get you back to feel like you're a kid again.
I would like that.
To me, you're still a kid. You're a young man.
Well, I like to think so until I look in the mirror, and then I wonder, who's that old guy looking back at me?
Well,
oh, it's
don't,
just that the mirror is distorted. Don't take it seriously.
don't let the old man in.
Yeah, don't do that.
I'm hoping my eyesight deteriorates enough, right?
Don't hope
enough
for
where I
that.
Still look good.
Don't hope for that. You know what you hope for? Every day I pray that I'm just happy and content with what is.
I am very happy and content with what is.
Yeah, that's really, I think, the key to life, because acceptance is the first law of spirit.
I accept that.
Ah, you're a funny man. I can't wait to meet you.
You know, that's funny because my favorite saying is acceptance is the answer to all my problems.
Well, it really is. And that doesn't mean you should just leave things the way they are. It means in the moment you're accepting, and then you do whatever you can to make the situation the way you want it to be. We're great philosophers.
Yes.
Then the question is, how do you enact all of this when you're not feeling that good?
One thought at a time.
Or better yet,
Yes.
One
there's
shot
something-
at a time.
God bless you, man. I appreciate your call.
Thank you, Matthew.
Nita, thank
Oh,
you for
you're
being a great
welcome.
host. The number to the office, 800-300-9300. The website, www.lastemcells.com. You can email me from there. And thank you, everybody.
Thank you, Alex and Suzette. Remember to tune in to Warren Eckstein, our pal who does the pet show from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.